Hey everyone, welcome back to the Unfiltered Fix. I'm Megan Sharpe, and today we're diving into a topic that's been a huge focus in the aesthetics world, dermal fillers. Joining me is someone who needs no introduction. Jason Peugh is a physician assistant at Zen Dermatology and Regenerative Medicine, and one of the most knowledgeable experts I know when it comes to injectables. Jason, thank you so much for being here with me today.
Thank you for having me.
I cannot stress to our listeners enough the importance of finding a provider that has extensive experience when it comes to fillers. You have been in the aesthetics since 2017 and have completed, I don't know at this point, tens if not hundreds of hours through various companies all over the country. I knew from the moment that I interviewed you that I needed you to be a part of our team. So I'm so excited to have you as part of Zen's team and to be talking to you about this topic today.
Thank you. I'm so grateful to have Zen. You guys have been so uplifting and supportive and have given me a home to do what I love most.
Awesome. I love that you feel at home. And it's a mutual feeling. Let's start with what dermal fillers are. So can you explain what they are and how they work to enhance facial features?
Yeah, so dermal fillers, there's many different types. However, the most common one that we talk about are going to be made up of hyaluronic acid. It's something that's naturally occurring within our skin, but these companies have created cross-linked gels that allow us to have longevity out of them. With fillers, we're volumizing. A lot of times what happens as our face ages is we lose certain tissues like fat, bone, and we can place these hyaluronic acid fillers in specific planes throughout the face to revolumize areas of lost volume.
I always joke, it's like hair and volume we lose it in areas we want it and we gain it in areas we don't want it. And I don't know why that is, but I sure am thankful for this development in the aesthetics world that can help replace that volume that's been lost.
Absolutely. I think there's a lot of bad rap for fillers out there right now. We're seeing the bad outcomes. That's what's being talked about. And I think the important thing is to remember is when you go to an experienced injector that's placing these products in the appropriate plane, you're going to get a good outcome. It's something that you just have to talk with your injector and make sure that you're on the right page with them as to what your result you're looking for.
Absolutely. That's so important. I think that open communication for sure. You know, it's fascinating. When I was preparing for today's episode, I've never really looked into the history of fillers. And I came across this article just talking about the different things that they've used in place of fillers on this journey of trying to find the perfect fit. And I know that it started in the late 1800s, which is crazy to think about, but they started with paraffin. And when I hear the word paraffin, I think that's what they dip my feet in when I go get a pedicure. And that's insane. Doctors thought that it could actually be used to smooth wrinkles or fix these problems. But what they found was that it caused bad side effects, infections, lumps, and they were finding that it even contributed to blindness.
Yes, there's a lot of bad outcomes that can happen with certain things, but especially when you're placing a foreign body into yourself, you have to make sure that you're using something that's safe.
Yeah, for sure. And then I know that, another thing that we don't talk a lot about is fat transfer. This was first tried by a doctor in Germany, and they were taking people's own fat and filling scars and, facial deficits, if you will. I actually, before I started working at Zen, I worked for a clinic that did a lot of fat transfer, and I certainly have mixed opinions about this. I would love to hear what your take is on fat transfer before I share my own.
Yeah, I think fat transfer can be helpful. However, I think the understanding that you have to have is that not all of the fat that's transferred is going to live. Fat is a tissue that requires blood supply. So when you take it from one area and place it into another, there's going to be some time where it takes to revascularize that area. And not all of that fat is going to get the nutrients that it needs to live.
For sure. And the other thing too, these are fat cells. So what does live and survive is going to expand and contract just like any other area of fat on our body. And so I've found that sometimes it doesn't give you a really well well-balanced facial feature, or it can also be used in other areas of the body. But I also found that the same was true for those other areas too.
Right. But, it goes back to even what we're talking about with filler, with having realistic expectations and making sure that your patient's informed on what things can go wrong and what to expect from the entire procedure.
Absolutely. And for those that are interested to learn more about the history of dermal fillers, how it began in the 1800s, there's actually a really good article in Dermatological Reviews titled Dermal Fillers History 101. So I'll drop the link in the show notes for those of you that are interested. I don't want to spend too much time on that because I know that these different things are not widely used anymore. So I want to jump into modern day fillers. So can you walk us through the most common ones and what you primarily use?
Yeah, I think there's a lot of talk about permanent versus semi-permanent. Most of us, I feel like in this field, are going to choose the option that's the safest. The safest filler to inject is going to be hyaluronic acid. And the reason why I say that is because it's reversible. There is an agent that we can inject post-injection, and it will dissolve that hyaluronic acid filler that we've replaced. It also comes to when we're needing to do corrections. We would do the same thing. We have a protocol, we make sure that we're following that, and we're able to safely dissolve that filler. And so I think a lot of times that's why injectors are going to pull from that kind of filler, because it's safe. There's other fillers like calcium hydroxyapatite or Radiesse, also a safe filler when used appropriately. It's also something that could be hyperdiluted to be used as a collagen stimulator, which I'm sure we'll talk about more later. There's a lot of different things out there. There's ones that are made up of bovine collagen. There's some that are not widely used because of the safety profile. A product that's short acting is going to give me an immediate result, but safe to inject and something that I can correct if it's not appropriate or if it doesn't look good.
So obviously when a patient comes in, we're trying to give the patient the best outcome, obviously the most natural result, but also we want to make sure that we're using a product that's going to give them the most longevity out of it. How do these different fillers in terms of composition and longevity work?
The way that they're able to make them last longer is by increasing the amount of cross-linking. The hyaluronic acid chains are these long chains, and we can kind of dice them up in a way and then put them back together with cross-linking chains, and that will help increase the longevity. However, the longer that something is in your body, the more likely you are to react to it. I would prefer something that's a little bit more short-acting, which would reduce potential complications for future. Something like Restylane Lift is great in the cheeks, Restylane Kiss. These all are indicated to last a year, which is appropriate. Anything that lasts beyond that, there's a higher risk of you actually reacting to it. Again, it's a rare complication, but it is something that you have to be aware of.
Yeah, I love that. I tell patients that with a lot of things too. Just because it lasts longer doesn't always mean that it's the best option. So I appreciate that take on things. In your experience, what are the most common areas where patients receive dermal fillers?
I'm pretty conservative in my use of dermal fillers, and I also like to talk about all the options when it comes to facial balancing and global restoration. My personal preference is I'll start with biostimulators, something like Sculptra. I'll do a series of that, and then I'll put the icing on the cake with the hyaluronic acid fillers. There's places that we can't put Sculptra, like under the eyes, in the lips, the lip lines that happen around the mouth, other small wrinkles and things. I would much rather use something that's going to give me a global volumization to minimize the use of hyaluronic acid fillers. I just think it gives a more undetectable appearance or result.
I totally agree. So you mentioned that there are specific fillers that are better suited for certain areas. Can you touch on that a little bit more?
Yeah, so there's this concept that we call G prime, and G prime is basically the viscosity or the thickness of the gel. Of course, we're thinking about areas that move like lines around the mouth. We want something that's a little bit thinner and available and an ability to stretch, so it moves naturally with your tissues. If we're trying to do something like add structure, like in the temples or the cheeks or the jawline, I'm going to want something that's a little bit more firm, or something that has a higher G prime, something that's going to give me that projection instead of being able to be flexible.
Yeah. When patients come in, obviously smile lines are a big area of concern for a lot of individuals. And when people call, just in the very beginning, they'll say, I need filler here. But what they don't realize is that you actually need to replace that structure to help support where your volume has been lost adjust so that you don't lose that natural dynamic movement in your face and you don't end up looking crazy, get overfilled around your mouth area.
Right. I like to think about, especially when it comes to smile lines, those are a symptom of something other that's causing that. And so when you're going to treat a medical condition, I would much rather cure the problem than just treat the symptom. So curing the problem is going to be replacing volume in other areas that lead to, revolumizing other areas that lead to these lines here, like the cheeks and temples. Start there and then work my way in and down.
And it looks amazing when injectors approach a face that way. What are some specific areas that you would want to avoid or proceed with extreme caution?
Yeah, so there's a lot of controversy. There's a lot of people that are doing things that are off label. There's people that will do things that are more risky, maybe based on their experience or their training. But I prefer not to place fillers in the nose and this area between the eyebrows because that's a really, really unsafe area. And there is, although rare, a risk of blindness. And I would not want to do that to any of my patients. So I just avoid it.
I had a friend and her mom has really deep lines, her 11s, and she went in and they told her that tox was definitely not going to help. And while we know that it's not necessarily going to release that tension altogether, it can certainly help smooth that appearance. But they immediately jumped to wanting to do filler in that area. And I was like, no, let's avoid that area. I think there are definitely other things that we can do to help smooth that. And we can kind of talk about how we approach things from an overall perspective and include other treatments that could potentially help smooth that area.
Yeah, I think when it comes to that, do a safe option like some laser resurfacing, combine that with good skincare, combine that with tox to help reduce the muscle movement that's creating the wrinkles. And it's something that you may not get completely gone, but it is something that we can reduce when we can minimize the appearance of those lines, but in a safe way.
Absolutely. And I think that's one of the important things about coming in and really doing a comprehensive consultation so that we can talk about what those realistic expectations are and using other modalities to help get our patients to the ideal goal that they're trying to reach, right?
Absolutely.
Who would you say are ideal candidates for dermal fillers?
So when I'm looking for a candidate for dermal fillers, it depends on the area that I'm treating, right? If somebody, for example, comes in and they have significant volume loss and they also have skin laxity, they're going to be a better candidate for surgery. I'm always going to tell my patients that a facelift is going to give them a better result. If that's what the result that you're looking for, that's what I would recommend. However, if you want to try something that is going to help improve your skin and help give you a more youthful appearance, I'm likely going to go and start with biostimulators first. When it comes to under eye filler, somebody that has, who's younger, who doesn't have skin laxity, who doesn't have bags under their eyes, they're a good candidate for tear trough filler, but not everyone is. And unfortunately, I'm not going to make a problem worse for you. And so I will be honest with my patients. If they're not a good candidate for it, then I won't do it. Results are important to me. I want to make sure that they're getting the best result possible. And if I can't provide that for them, I'm going to let them know. Good candidate for filler, I think it's highly dependent on the area that you're treating, the facial structure of the person, the quality of the skin. There's so many different variables that we have to look at before we determine if somebody's a candidate.
I love that you talk about the surgical approach versus the non-surgical approach. And we see a lot in our practice that certain people are not opposed to surgery while others are completely against it. And I definitely think that both have their place in this field.
Absolutely. I think a non-surgical approach for most people is what they're looking for. I mean, my patients come to me frequently. I'm not ready for surgery, but I will be realistic and I will set those expectations because I want to make sure that my patients are knowing what they're getting. So just educating the patient, making sure that they know what's happening, that they understand that the result's not going to be as good as a facelift. Most patients are still happy with the result after that because we've already set that expectation for them. So
For
I
sure.
think just finding the right balance for each patient is important.
I agree with that completely. How do you assess a patient's suitability for filler treatments? And I really want you to actually focus on the difference between men and women because obviously our anatomy, our facial structure is different. We certainly don't want to overly feminize a man. And so I would love to hear how you take those different things into consideration.
Honestly, that's something I'm really passionate about. Because there is such a huge difference in the male and female aesthetic, it requires a different injection approach. So for women, for example, a heart-shaped face is very feminine. So we want that kind of V-line jawline, bigger cheek, more fullness at the top, because that's going to be a sign of youth. As we age, of course, we kind of turn into the triangle. So we want to put those things back where they were. For men, it's a more squared off appearance. So a little bit more angular, a little bit more structured, less high and wide, but with a little bit more forward projection. So when I'm evaluating a patient, I'm going to ask them what result they are looking for. Even women may want a more masculine appearance. It just depends on their personality, even what they do for work sometimes. If somebody comes in and they have a little bit more of a masculine appearance, they're going to give a bit more of that bravado, like they're going to show up a little bit differently. It's going to have they're going to be a little bit more confident. I think that that's something that's really important to think about is, what does my patient do? What fits their lifestyle and what are their goals, to kind of come up with something. So if a woman is looking for a more masculine appearance, that's something that you have to talk about with them as well. But same thing with men, especially gay men. I see a lot of gay men and I want to know, what are you looking for? I'm never going to assume, do you want a feminine look or do you want a masculine look? I'm going to have that discussion with them so that we make sure that we're giving them the best result possible. But I will say, it is a very different approach to aesthetics, a very different injection technique, and it's something that I personally I love doing. So especially with my non-binary patients that are looking to get some gender-affirming aesthetic care, it's one of my favorite things to do.
It's so interesting that you talk about that, because that's actually something that I talk about on the podcast a lot, is just how your looks actually play such a big role in how you carry yourself and how you show up in your daily life. And I think that's something that a lot of people don't really take into consideration. And so I guess that's one of the things that sets you apart and really makes you the expert, is really talking to your patients about what look they're trying to achieve and then delivering that result if and when at all possible.
Absolutely. I've always held firm in the belief that my priority is my relationship with my patient and the result that I provide. And the rest will come. Honestly, just want to make sure that my patients are comfortable, that we've developed a trusting relationship, and we have open communication so that, if there's something that they like or don't like, I'm going to make sure that they have a safe space to come to me and talk to me about those concerns.
And that's why all of our patients absolutely love you.
Thank you.
Can you tell me if you have a personal favorite dermal fillers that you find yourself recommending more often than others? And if so, why?
Yeah, so I would say I tend to attract a younger population. Now working at Zen, I get people of all ages, which is great. But the most filler is going to be the lips. People love lip filler. It's something they will come back for time and time again. However, I'm really conservative in the way that I treat my patients. And so when I'm trying to determine which filler that they want, I'm also asking them what their goals are, because I can really dial in what they're looking for with injection technique and product selection, and making sure that everything's balanced with the rest of their face. But the two products that I pick for that are going to be Restylane Kiss and Juvederm Volbella. The reason I picked those is because Restylane Kiss is less hydrophilic. It doesn't pull in as much water, so it doesn't tend to look puffy. It gives me a really nicely defined, structured lip, which I feel like a lot of my patients are looking for. And then when it comes to somebody that wants a softer, more natural appearance, I love Juvederm Volbella because it's just very soft and stretchy. Somebody that comes in and just wants a little bit of hydration, without the structure or that big lip look, I will pull Juvederm Volbella for that. Honestly, I don't pull any other products off the shelf for lips. I have had different outcomes with different fillers, but those are the two go-tos that I have that give me the best result.
Can you talk a little bit about migration? I know this is something that you and I have addressed for me personally, so I would love for you to share with our listeners what migration is and what to be looking looking for?
Right. So lip migration specifically, two most common areas that we're going to see migration in are going to be around the lip and around the eye, so the under eye. There's a lot of movement in those muscles. So both around the mouth and around the eye, we have circular muscles that contract and tend to push things in different areas. The lip specifically, there's not a divider between the body of the lip and the skin above the lip. So things can just overflow. So over time, with continued use of certain products that tend to be a little bit more hydrophilic, where it attracts more water, they tend to spill over a little bit more. When you overfill, when you fill too quickly, so you're doing a series of treatments, but you do them too quickly, there's more of a likelihood of that actually spilling over into that area. What you're going to see is something that we call filler mustache. And the best way to see it is to purse your lips together, and you're going to see a dividing line where you're going to see a fullness in that skin. That's the easiest way to tell if somebody has lip filler migration if you can't see it before that, which most of the time we can. So I think it's something that we have to have a conversation with our patients about. I have my patients wait 3 to 6 months in between different treatments. So if we're going to add lip filler, I make them wait 3 to 6 months just to reduce that risk. I also make sure that product selection is on point so that we're not getting that hydrophilic overflow. And then I'm trying not to overfill my patients so that so that we can minimize those risks. Under the eye, that's a different story. You're really going to see this under eye filler. A lot of times it'll be a bluish gray discoloration. It may look puffy. It may look like you have bags under your eyes. Over time, with inappropriate filler placement, it will migrate forward. So we're going to see that more, and you're going to actually see the bluish discoloration from something called the Tyndall effect, which is light reflecting from that filler, and it's showing up as that blue-gray discoloration under the eye.
And this is something we actually do see in the practice a lot. Patients come in, they're looking to address it. And I think one of the misconceptions when it comes to under eye filler migration is that they think they need more of it because of the appearance of those bags, when in reality, what they need is correction. And I would love for you to talk about how we would correct something like that, whether it be under the eyes or in the lips.
Right. So I frequently dissolve under eye filler. It is probably one of the biggest headaches in the aesthetic industry, in my opinion, because it does cause so many problems. So most of us at this point are looking for alternatives to treatment. The way that I would handle that is I would dissolve it, and then I would have a discussion with the patient. Let's do something that's going to improve the quality of the skin under and around your eye. Something like microneedling, something like PRP injections or exosomes. I really like our Photona Smooth Eye. So
Love
stacking
it.
that energy into that skin where you get almost instant tightening. In some cases, we can add on some resurfacing with that. We can treat the under eye bags, the little fat herniations with that laser. So I would go towards an alternative treatment just to improve the quality of the skin in that area before I were to refill if they need it. Sometimes just with these other treatments, we're going to get the result that they're looking for. I've literally had a patient, she looked like she had allergy eyes. I dissolved all of her filler. We did a round of Sculptra for full global volumization. I did not put filler back under her eyes. She did not need it. So just doing things even indirectly are going to give patients a better result sometimes.
Yes. Oh my gosh. That's so true. So true. And you had mentioned that a lot of people are starting to look for alternative treatments to filler. And there has been a lot of talk in the aesthetics community about filler fatigue. Can you explain what this term means?
Yeah, so filler fatigue is basically the outcome of using filler. A lot of times what I like to think is it's excessive filler. So what we're thinking about are the physical effects of it. So, migration, poor outcomes. We're also thinking about the emotional part of it, where people are becoming more insecure or developing body dysmorphia because of it. And then some of the physical changes that happen with filler as well. So we can look abnormal if we've had an excessive use of filler over time. That is not our goal here at Zen. It's never been my goal personally, but I would be more than happy to tell somebody no, or let's come up with a different plan to get you the result that you're looking for. Filler fatigue is also a result of hearing about bad outcomes in the industry, which also kind of gives us a bad name because we're not all going to give you those types of results. And so there's a bit of a stigma in the industry about that currently, but I also also think that I have seen a change in less people looking for filler and more people looking for a natural result. Now, I prefer an undetectable result. So an undetectable result is using these products appropriately, even dermal fillers, in a way that gives you a result that people can't tell. You know, you just look more youthful and refreshed. We're naturally enhancing your features without augmenting your face in a way that makes you look abnormal.
It's so important. I was recently just at a conference, as you know. There were thousands of attendees there. And obviously, being in this industry, I do tend to kind of observe a little bit more in detail than the average person probably would. It was interesting to me to watch these women walk around that have most likely been using fillers for many, many years, upon probably the conception of dermal fillers. And you start to see that shift. You can tell that they've been overfilled. You can tell that their product is migrating. They're starting to get lumpy and bumpy, and they're losing the actual natural structure of their face. And it's not a good look.
No, and I think that something that we often forget are a lot of these results are a result of trends. There's huge trends that happen in aesthetic medicine where one day something is in and the next day it's out. So I think really giving somebody that undetectable result, it's going to be timeless. You're going to honor your patient in the long run. I think that if we are augmenting people's faces to the point where everybody looks the same, we're not honoring somebody's natural beauty. And it's insulting.
Yeah, we're not trying to achieve the Stepford Wives look here. There was actually recently an article published in the Business of Fashion about this, and the title was Filler Fatigue is Setting In. And it talks about the category of biostimulators. And you had spoken about them a little bit earlier. You had mentioned Radiesse and Sculptra. I would like for you to talk a little bit more in detail about what biostimulators are and how you incorporate them into your assessment of a patient.
So, first of all, Sculptra is hands down my favorite product. I use it myself. I get a treatment annually. It is something that I recommend to my patients on a daily basis. It's something that I perform multiple times a day, and the results that I get from it are just absolutely fantastic. But what we're thinking about is biostimulators are typically made of, like in the case of Sculptra, it's poly-L-lactic acid, and in the case of Radiesse, it's calcium hydroxyapatite. These products basically create an immune response within the skin. So it's a powder in suspension mixed with a little lidocaine. We place it within the tissues at specific planes depending on the result that we're trying to achieve. And over time, your body gobbles up those little molecules and it converts it to natural collagen. I like to think about collagen as being the scaffolding of the skin. It adds structure. So the loss of collagen leads to skin laxity, it leads to crepiness, it leads to fine lines and wrinkles. When we're revolumizing with a biostimulator, we're also getting a change in the skin texture. I like the bonus of both benefits. So a global revolumization and an improvement in the skin texture. But again, these products have been around for a long time and the safety profile is just spectacular. When it comes to bad outcomes, if in the hands of the right injector, the bad outcomes or the risk that are involved are going to be really decreased with using these types of products. So, and you're not going to get that overfilled look from it. It just looks more natural.
It does. It really does. It's an absolutely beautiful product. There's normally this rule of thumb that 1 vial per decade of life is needed when using Sculptra. Obviously, everybody ages a little bit differently, and sometimes that's not always the case. How do you assess how much to use in a patient?
I still tell patients, look, we typically recommend 1 vial per decade of age. However, I've had patients in their 30s that needed 6 vials because they'd had significant facial volume loss. So it's going to be really patient dependent. And a lot of times what I'll tell my patients is, look, let's do a series of these. Let's plan for 1 vial per decade of age. And then let's wait 3 to 6 months and see if you're happy with your result. If you're not, we add more. We can take it slow. With most of my patients, I usually am on like a 2-year plan for them. I think about things, what can I do over the next 2 years to get you where you want to be? It doesn't have to be rushed. And I think that sense of urgency and taking that away makes my patients a lot more comfortable. And we can just do a little at a time, and it improves their comfort level overall, and it improves outcomes because we're not just shoving a bunch of stuff in somebody's face.
I love that you can build on it over time and it's not that approach where you have to use everything all at one time, especially with Ozempic face. I mean, that's huge. You know, people are being prescribed these GLP-1s and not being monitored, and they have rapid weight loss, which is contributing to this weird saggy appearance. And it's amazing that we have this product that we can use to help rebuild that structure that's been lost for these patients so they can truly have the best of both worlds.
Right. If we think about it, back to like facial fat volume loss, Sculptra was actually developed several decades ago. It was used for facial wasting in HIV patients. Revolumizing somebody that's lost fat in their face, this is the best product for that, right? So we can actually combat your facial wasting using biostimulators as well, concurrently with these GLP-1s. And we also want to make sure that their diet is fully balanced and they're eating plenty of protein, or supplemented on something like Givome or collagen boost stimulator, right? So adding something that's going to boost your collagen levels and give you the protein and the amino acids that you need to build that collagen is very important while you're on these GLP-1s. So we can do these concurrently so that you don't get those bad side effects.
Yeah, GLP-1s or none. Collagen production is just so important. Like you said, it really is the structure of our face and our body in general. And I think that everyone that's in their 30s or older should be either taking a collagen supplement or using something that stimulates their collagen, or better yet, both, right? Simultaneously. My favorite product is our Givome's Pro Collagen. And I always kind of laugh when people are like, well, where does the collagen come from? Because there's bovine and marine collagen. My description of it is it's a non-collagen collagen. The ingredients were truly scientifically chosen to stimulate your body's own collagen production, and tastes amazing as well. So I will add the link to that particular product in the show notes, because it's amazing that you can use this with or in conjunction with all of the services that we do at Zen or in any aesthetics practice, really.
Right. Even if your diet, you're not on a GLP-1, if we're going to be doing anything collagen stimulating, I would recommend that somebody's on that just to boost your results. I'm one of those people, do what you can to make the best of your result. It requires the homework. So it requires the supplementation. It requires the skincare. I tell that to all of my patients. Having something that's going to boost your collagen levels during a treatment like this is very important.
Yeah. You had mentioned a little bit ago some of the strategies that you use to help prevent or address filler fatigue in your patients. I would really love for you to talk about ways that we do that at Zen, specifically like our 4D using our Fotona, obviously our non-needle lip injections, or the Smooth Eye that you'd mentioned just a minute ago.
Yeah, so an alternative to filler where we're trying to basically put things back where they once were, I like to think about lasers in conjunction with biostimulators. I always tell people the three things I couldn't live without: Botox, lasers, and biostimulators. If I could have just three things, that's all I would want. I know that's asking for a lot though for a lot of people, but we can actually effectively retrain the skin. Basically. So we're stacking in energy to heat the tissues, to stimulate a collagen response for firmer, tighter skin and a more lifted appearance, right? So treating some of those skin laxity issues too with laser, or skin texture issues, are going to help maximize your results with the other things as well. So again, a multimodality approach to these things. So pairing the biostimulators with a laser procedure and supplementation are going to give you your best outcome.
Yeah. And I know obviously in the ideal world, we would be able to utilize all of these modalities on all of our patients, because we know that it does truly give them the best appearance, the best results to help them achieve their goals. When somebody is on a budget, how do you ensure that patients have realistic expectations and understand what the potential risks and benefits are when it comes to the services that we offer?
For me, I actually ask what patients' budgets are. I think it's very important to see what you're working with. I want to give them the best bang for their buck, but I also understand that I have to give them a result within their expected budget as well. So being open and honest and communicative of those expectations, and keeping it real. I mean, I don't lie to my patients. I give them my honest opinion, and I think that that's something that you could ask many of my patients about. I'm sure they have some funny stories, but just being honest and working with somebody's budget, but just letting them know, look, we don't have to do all this right now. I can print up an entire treatment plan for you, but why don't we space it out? Let's plan for a quarterly treatment, making sure that I'm budget conscious, but also giving them realistic expectations within that budget.
Yeah. So if a patient comes in and they say, you know that they need a lot of volume added to their face and they only budgeting for maybe one syringe of filler, can you give our listeners an idea of how much they're going to get with one syringe of filler?
Not much. So if we think about one syringe of filler is 1 milliliter, that is the size of a small blueberry. We can make big changes with a little amount of product when placed appropriately. But if somebody needs global revolumization, I cannot do anything with one syringe. And I will actually tell you, don't waste your money.
Yeah, that's
syringe.
A good point. We recently had a patient come in, as you are well aware, and had purchased one syringe on a special that we had through one of our events, thinking that they were going to get the, result that they were looking for. And they didn't have it within their budget to do more filler at that time. And you actually did let them know that they weren't going to get the results. And we ended up refunding their money, which is not something we typically do, but, refunds are few and far between, but it is very, very important for patients to come in with the education and understanding that we are there with their best interest at heart.
Absolutely. Again, if I can't give them the result that they're looking for, I just don't perform the procedure. I think that it's important for patient education. I think it's important for relationships with patients. And again, honesty and transparency and building that relationship of trust with my patients is so important that I will tell you no if I don't think that it's an appropriate use or if you're not going to get the result that you're looking for.
And I will support you in that decision all day, every day. Is there anything else that would be important for people to consider before inquiring about getting dermal fillers that you would like for them to know?
Right. So the most important thing is a consultation. Sit down with your injector. Discuss what your needs are, discuss what your concerns are. And of course, a trained injector is going to be asking you the questions, the right questions, to see where you want to take things. Again, sit down with your injector, talk about your goals, where you want to take it, how fast you want it to be. Talk about your budget. Talk about everything. Don't be afraid to ask for what you need. I think that's the most important thing. I want to have that open communication with my patients so that I can give them the best outcome possible.
For sure. Well, Jason, this has been such an insightful conversation. I think we've covered everything from the history and science behind fillers to how they can truly transform a patient's appearance when done right and everything in between.
Well, thank you for having me, Megan. It was a pleasure.
Absolutely. And for anyone listening who's curious about fillers, biostimulators, or other facial enhancements, be sure to schedule a consultation at Zen Dermatology and Regenerative Medicine. I'll be sure to put the link in my show notes. And if you enjoyed this episode with Jason, I think you'll really enjoy the next episode we do together because Jason is also our expert on men's sexual wellness. So if you or a partner could benefit from hearing that discussion and are looking to improve your pleasure and performance in the bedroom, don't forget to subscribe to my YouTube channel and the Unfiltered Fix on Apple Podcast and Spotify so you don't miss an episode. This is a topic he and I love, so it'll be a fun one. Thank you so much for tuning in to today's episode, and I hope you have a wonderful day.